The type of open wound caused by the skin rubbing against a rough surface is abrasion. Though superficial, this wound needs to be carefully treated to fight off infection and heal quickly. These following steps, abrasion can typically be safely handled at home. With mild soap, clean the wound with cool to warm water. Don't use hydrogen peroxide or alcohol to disinfect the wound. Using hydrogen peroxide or rubbing alcohol to clean the tissue and interrupt healing with potential damage the injury. Place a clean towel over the wound and put your palm under direct pressure. Apply a thin layer of antibacterial ointment to the wound. If the wound is minor, it can be left exposed in the air before the wound heals.
Audio Jungle. Audio Jungle. Audio Jungle.
Apply immediate pressure to the severe part with a clean piece of cloth para hindi na agad-agad siya dumugo pa.
Audio Jungle.
Second, let the patient lay down.
Audio Jungle.
Para hindi masyadong kumalat yung dugo at hindi na masyadong lumabas ng dugo doon sa severe part.
Audio Jungle.
Third, immediate call for emergency or call 117
Audio Jungle.
para magamot mo na maaga at maging mataas ang tsansa na pwede pang mabalik ang kanyang naputol na parte.
Audio Jungle. Audio Jungle.
Lastly, conserve the severe body part of the patient
Audio Jungle.
para hindi mamatay na putol na parte at malaking tsansa na pwede pa tong may balik.
Audio Jungle. Audio Jungle. Audio Jungle.
Okay, recap. First, apply pressure to the severe part with a clean piece of cloth. Second, let the patient lie down to lessen the blood loss on the severe part. Third, immediate call for emergency services like 117. And lastly, put the severe part on a piece of clean cloth and put it in the plastic bag full of ice.
Avulsion. An avulsion is a serious soft tissue injury. It happens when a portion of the skin and sometimes other soft tissues is partially or completely torn away.
Putting first aid ng avulsion. Kapag minor lang po ang sugat sa avulsion, pwede naman po lang siya i-rinse in running water para i-disinfect lang po. Pero kapag major na po, na tulad po nito, we can use spot apply pressure and place above the head the injury. Parang ganito po. Apply pressure po, kasi tataas po natin, para po less blood loss. If yung tela niyo po is not too much absorbent, pwede po palitan. Kapag napuno na po ng dugo yung una yung cloth na ginamit pa apply ng pressure, palitan po ito agad. Pero apply pa rin po ng pressure para po hindi po magtuloy-tuloy yung blood loss.
Good day, I am Lorenzo Dizon, and I am here to teach you how to give first aid on a puncture wound. Puncture wound is a deep wound that occurs due to something sharp and pointed, such as nail. Well, a puncture wound doesn't usually bleed, but these wounds are often deep and can be dangerous because of the risk of infection. How you apply first aid on a puncture wound. First, wash your hand with a clean cloth. Remove the penetrated object. Once the object is removed, stop the bleeding. Apply a gentle pressure with a clean bandage or a cloth. Next step, wash in the wound. Right in the wound with the clear water for 5 to 10 minutes. If the dirt or debris remain in the wound, use a washcloth to gently scrub it off. See a doctor if you can't remove all the dirt or debris. The next step, apply an antibiotic. Apply a thin layer of an antibiotic cream or for the first 2 days, rewash the area and apply antibiotic when you change the dressing. Cover the wound. Bandages help the wound bleed. Change the dressing. Do this daily or whenever the bandage becomes wet or dirty. Watch for sign of infection. See the doctor if the wound isn't healing or you notice any spreading redness, increased pain, pus, swelling, or fever.
Incision is a type of wounds that causes by surgery or something sharp smooth objects like knives and glasses. So, ano kailangan natin gawin if accidentally nating nahiwa yung sarili natin ng knives? So, the first thing we need to do is to control the bleeding and elevate the wounded part. Para, kailangan nating i-elevate siya para yung dugo, hindi siya masyadong lumabas. Hindi madaming dugo yung lumabas sa'yo. So, after nating makontrol yung bleeding, we need to apply antiseptic or alcohol para mawala yung germs like alcohol. Tapos, apply lang natin dun sa mismong wound para malinis siya. So, ayan. After nating ma-applyan siya ng kailangan natin lagyan ng band-aid or bandage, gasa, para hindi siya lalong ma-infection or kapitan ng dumi, if ever. So, ayan. So, ayan. So, kailangan malinis din yung bandage. Ayan.
I'm going to demonstrate on how to do first aid in an open wound. So the type of unopened wound that I have here is laceration. Laceration happens when the soft tissue in the body are torn. So I'm going to do now the first aid, but first I'm going to use alcohol in my hands. So the first thing to do is control the bleeding of the wound using cloth. When the bleeding is controlled, put on antiseptic. I'm going to use agloxinada. And I'm going to use next day betadine for the wound. And after that, I'm going to use the cloth to cover the wound. I'm going to use the gauze. Going to roll it all over the wound, the arm. And I'm going to take it so it won't come off. That's it.
Having wounds really give you a hard time to make your works done, especially those deep cut wounds. They take centuries to heal. Hi, I'm Orlando Ibanez Jr. and I am here to tackle about a type of open wound that is called puncture wound and how to apply first aid on it. Let's think of a scenario.
A guy fell to the ground that has broken glasses. Now, the impact of his hand to the ground will cause cuts or what you call wound. Since the ground has broken glasses, we can assume that small pieces of it penetrates the skin which caused the wound. That is puncture wound.
Puncture wound is a forceful injury caused by a sharp, pointed object that penetrates the skin. It is usually narrower and deeper than a cut or scrape. Now, do you have a puncture wound? Here's how you apply first aid on it.
First, wash your hands. This will help prevent infections. Next, stop the bleeding. You can control the bleeding by applying gentle pressure with a bandage or clean cloth. If there are some small debris penetrated in the skin, you may use sanitized tweezers to remove it. Or, if it's big enough, you can use your hands. After removing the debris, clean the wound by rinsing it with clear water for 5 to 10 minutes. Now after rinsing it, apply antibiotics and then cover the wound using bandage.
That's all for puncture wounds and how to apply first aid on it. Thank you for watching.
Yan ang isang halimbawa ng sugat. Banlawan ito ng malinis na tubig at pagkatapos ay sabunin. At pagkatapos ay banlawan ito ulit at kumuha ng isang malinis na tuwalya upang ipagpunas sa sugat. At pagkatapos ay lagyan ng betadine ang paligid ng sugat papasok